Today's presentation is about transcranial direct current stimulation and its use for major depressive disorder. This presentation aims to explain what major depressive disorder is and its physiological mechanisms, transcranial direct current stimulation, or TDCS, and the physiological effects, as well as research in the use of TDCS as a treatment option for major depressive disorder, and discussing any gaps in literature and the direction for further research and understanding on the topic. The DSM-5 has characterized major depressive disorder as a discrete episode of at least 2 weeks duration involving changes in affect, cognition, and neurovegetative functions and inter-episode remissions. Although symptoms may vary from person to person, some common symptoms include compromised ability in maintaining attention, lower levels of motivation, impaired memory, and cognitive limitations. With this disorder and the symptoms attached, a person's ability to maintain and manage daily tasks, as well as progression through education, employment, or self-progression is compromised. The use of severity and specifiers, as well as specifiers without codes, is useful in identifying the level of which the disorder is having an impact, as well as the current traits of an episode. Identifying the severity and specifics helps identify the best treatment option, as well as further understand the individual situations. Specifiers can only be used in an official diagnosis of major depressive disorder. It is important when treating major depressive disorder to identify that major depressive disorder is the main disorder and not a secondary disorder, as this impacts treatment and remission. It is important that the effective evaluation has been made and other disorders have been identified and treated. These include, but not limited to, medical conditions, substance/medical-induced depression, bereavement, bipolar, and schizophrenia. Biological factors such as variations in genes, environmental factors such as adverse childhood and life experiences, as well as course modifiers, can also contribute to major depressive disorder. There are many theories when looking at the physiological mechanisms of major depressive disorder. On this slide, there are several listed. Monoamine theory suggests that deficiencies in neurotransmitters, listed below, are the cause of depression. This theory was identified and commonly accepted due to the response of antidepressants increasing neurotransmitters, therefore minimizing effects of symptoms of major depressive disorder. This allows individuals to start feeling better and be able to focus on their recovery. According to neurocircuitry hypothesis of depression, there are large-scale brain circuits underlying cognitive and emotional functions. Specific circuits are involved and responsible for the core symptoms of depression. Decreased neurogenesis and neuroplasticity theories suggest change in the brain structure, the way the brain can rewire and adapt to change. When there is dysregulation or compromised neurotransmitters, the neural circuit is impacted with mood regulation. Inflammation theories of HPA axis dysregulation identifies that due to chronic stress and HPA axis continues to release hormones on the accelerated basis, then the HPA axis stops recognizing signals and stops producing hormones. Although this is identified as a valid theory, the comorbidity of stress and stress-related disorders can impact the understanding when we only look at major depressive disorder. So what is transcranial direct current stimulation? In history, there was evidence of the use of electricity in animal studies. Giovanni Aldini was a physics professor in the 1700s who identified from animal studies that electricity was a long-sought vital force coursing from brain to muscle, and he used this to treat patients with melancholy and personality disorder. With additional research, such as studies conducted on rats, was identified that there's an increase in neural firing and increase in potential. The research identified low magnitude alterations of targeted neurons, lasting a few minutes, caused prolonged change in the rate of activity. also identified an increase of firing rate of cortical cells. In modern day, TDCS is a non-invasive method of stimulating currents areas of the brain to temporarily modify behaviors, increase performance, and learning. Strength of response of cortical neurons to the given stimulation produces effect that stops or slows down a process upon a variety of behaviors. TDCS increases or decreases strength of response of cortical neurons via anodal depolarization of neurons, increasing the probability of action potentials, and cathodal hyperpolarization of neurons, which decrease the likelihood of action potential occurring. The stimulating electrodes is placed over the target cortical area and the other is placed on the opposite side. Several studies have highlighted the significance of TDCS when treating major depressive disorder. Study 1 includes a control group rating on the Hamilton Depression Rating Scale. Study conducted with the criteria of individuals needing a diagnosis of major depressive disorder or who have had a major depressive disorder episode. Results demonstrated that the intervention of the active TDCS was superior to the use of the sham TDCS in improving major depressive disorder. The study noted TDCS might be an effective treatment for major depressive disorder. Study 2 consists of a 3-week randomized trial highlighting improvements in areas of working memory and mood improvement, which are key traits in major depressive disorder. The highlights the various ways TDC can be used to target. Study 3 looks at the prevention aspect of relapse in major depressive disorder with a 6-month follow-up. On a weekly basis, individuals were administered TDCS for 3 months, then once per fortnight for the next 3 months. Mood ratings were compared at both milestones. It was identified as a useful strategy to prevent relapse. Study 4 focused on combining the use of TDCS with cognitive emotion therapy. It was shown to have improved in only emotional regulation, which can contribute to the improvement and treatment of major depressive disorder. It was identified that further research should be done on each process and to continue controlled studies. It's important to identify and understand the room for further research. Research has identified that comorbidity of other conditions may increase the risk of major depressive disorder. Understanding and analyzing individual experiences and completing studies based on target groups which minimize other disorders. Conducting studies where individuals have a complete examination, including neuroimaging, to identify brain structures and delve deeper into this space. It has been identified that major depressive disorder has different subtypes, specifiers, and subspecifiers. Although it is hard to fully understand major depressive disorder, it would be an effective way to understand major depressive disorders and the use of TDCS when categories are identified, whether this be in severity or specifiers, and comparing the results with effectiveness of TDCS. Research should be put into longitudinal studies and understanding the development of individuals and the management of the condition. Considering studies which look at individuals up to elderly age, so to see the change in the brain functions and whether this can be identified due to major depressive disorder or common aging traits.